I was active. I was constantly going. My day consisted of usually an 18-hour day from the time I got up in the morning to the time I finally got back into bed.
Charles Suggs loved leading a very active life. When he wasn't working as an electrician, Charles enjoyed a wide range of hobbies, from hunting to fishing and golf.
He was a big outdoorsman. He really liked to be outside. He always liked to be on the go.
For years, Charles struggled with chronic back pain, but he coped by simply taking over-the-counter drugs.
I'm the kind of person that never went to a doctor. You know, if I had a broken bone or I needed stitches, I'd go to the doctor. But anything else, you just walked it off.
But in 2005, his condition took a dramatic turn for the worse.
It started getting to the point where I couldn't walk. My legs were going numb. My feet were going numb, and it became a real problem.
And the pain was unbearable.
It just nags at you. It just wears on your body. It wears on your body until it breaks your psyche.
Racked with pain, Charles retired, and at the age of 50, the active life he led was over.
There was days where I had to crawl from the bedroom to just to the bathroom because I just couldn't pick this leg up. My leg just wouldn't work. My life progressively got a lot worse.
It was very hard for a man that was active all the time to nothing.
Rarely leaving the house, Charles gained more than 100 pounds and battled depression.
It comes a point in time when if this is all it is this good enough? Luckily, I kept moving. I chose not to lay down and just die.
He's only 50-odd years old. He can't sit in a chair for the rest of his life. What are you going to do?
You know, it's time to go to the doctor.
In 2007, Charles finally sought medical help. His doctor referred him to an orthopedic surgeon, Dr. Nilesh Patel.
Hey, Doc, how you doing? Good, how are you? Good to see you.
His diagnosis? Lumbar spinal stenosis.
Lumbar spinal stenosis is a condition in the spine where the nerves are slowly being compressed as the spine ages. So as the spine ages, the joints grow. And as those joints grow, they crowd in around the nerves.
That compression or crushing of the nerves caused the painful symptoms Charles and many LSS patients experience.
As the joints crowd in around the nerves, people will start to get sensations of the nerves being affected. They'll start to feel pains going down their legs, some back pain, have trouble walking, notice weakness and tingling.
Dr. Patel initially treated Charles with epidural steroid injections.
The problem with the epidural was it didn't last. You know, I felt great for 2 weeks, but on the third week I started on a downward spiral again.
Frustrated with the epidural's temporary relief, Charles didn't hesitate to consider Dr. Patel's next suggestion, the X-stop spacer.
The X-stop works by preventing extension, and when a patient leans backwards or stands up, they extend their spine and the nerves get pinched.
The X-stop is implanted between the spinous processes and is designed to keep this space open. So when a patient stands up, their nerves are no longer pinched. And a key benefit for Charles, the X-stop spacer is implanted during a minimally invasive procedure.
He told me straight up that it was the less invasive procedure he had available to minimize some of the pain that I was in.
Charles couldn't believe that just hours after the 60-minute surgery, he was up and about.
I went up a flight of stairs like I was 12 years old again, you know? I mean, I could actually climb the stairs. I could push off. I could feel my legs.
After a short recovery, Charles felt he had a new lease on life.
4 weeks after the surgery, I felt so good. I was marching up and down my driveway because it felt so good just to move, to be active again. I could see the light again, so to speak. There was a light at the end of the tunnel. It wasn't a train coming at me, you know?
His health is improving all the way around because now he's losing weight, which is better. His blood pressure's coming down. He's, you know, so it's all one big circle.
That's in St. Pete. That's right here. See these bridges? Those are the bridges we went over.
Now, Charles and Judy can focus on the future and enjoy the active lifestyle they treasure.
Yeah, I put that one X-stop in. It gave me my life back. It's like being born again. It's like finding your life. It's like winning the lottery, you know? It is.
This This story reflects one person's experience. Not every person will receive the same results. Talk to your doctor about your treatment options.